Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm going to answer the question, hey doc, why aren't you taking my insurance anymore? So there are a whole bunch of reasons, and I'm going to go into them. I'm going to be very, very plain with you, and I'm going to show you evidence as well. Pictures, documents, things along those lines. That way you all better understand why dentists and dental practices across the country, thousands of them, are kicking insurance to the curb. Well, first of all, what's going on? Well, insurance companies are slashing our reimbursements. So those of us who take insurance are seeing reductions of fee schedules by a whole bunch of different percentages. I've heard as high as 30 to 35%. Now, I'll show you, of course, pictures. As you can now see, I'm showing you different people across the country who are expressing how much their reimbursements are dropping. And this doesn't really make for a good, practice or business. Now, we are in healthcare, we are taking care of people, but we have to be able to keep a business going. And if we all of a sudden are faced with reduced payments by 30%, and if you're already accepting insurance, you're already basically losing probably about 10 to 15% minimum of what you're doing any which way. Now you're losing anywhere from 30 to 40%. That doesn't make any sense. So practices can't stay open if our supplies are going up in cost with inflation, as you all know, and then our payment goes down. So that doesn't work. Fee schedules also in some cases aren't changing. So they're not increasing the fee schedule by any measurable amount. Now, it might not be all insurance companies, but it seems like the big ones, and in fact, a lot of them are doing this. Number two, so while our costs climb and reimbursements drop, and for you who are patients who may have insurance, maybe your premiums are going up, your benefits are usually not changing, so you can check that. I don't know if they've changed or not. You'd have to check that, and different insurance companies they might not. But if they don't change your benefit amount, yet your premiums go up and they're slashing your reimbursements, what's happening? Their executives are making millions. In fact, they're increasing their salaries. So does that sound like it's right to you? Now, again, I'm not saying that this is a blanket for every single insurance company. I'm not naming insurance companies. But as you're seeing pictures, there are some executives that are doing quite well. So that's something else that you all should be thinking about. So what else is going on? Well, let's just say they like to keep people waiting on the phone. There are people that are reporting very, very, very extended wait times. And as you can see in these pictures that I'm showing you, I guess they're hoping that people give up, because being on hold for 2 hours to try to solve some sort of an insurance issue, when a practice is trying to go to bat for a patient and figure out what's going on with benefits, and they put people on hold for 2 hours, how do they expect people to work? How do they expect a business to function? Are you asking yourself that question? I always ask myself that question. And now, what's the newest trick? Because there is a new trick, and this comes straight from a dental insurance employee insider from the West Coast who reached out to me to tell me that this was coming and it was going to be implemented soon. In fact, pretty early on in 2022. Artificial intelligence. They're going to use artificial intelligence to try to create yet another obstacle. So here's the text, as you can see, plain as day. So they're going to be using artificial intelligence in their attempt to help, the air quotes, help make things more efficient. I'm just not sure how that's going to be helping. And like I said, yes, this is a verified employee from one of the major insurance companies who did not want to be identified, of course, for obvious reasons. This person's on the West Coast. But yeah, this is coming down. It's very real. So you have to ask yourself at this point, is dental insurance worthwhile or not? That's a personal choice. You have to decide that. But many practices are now saying, we've had enough. We can't take this. It simply doesn't make any kind of financial sense for us to basically be losing money to treat people. We'll go out of business, and I don't blame them. I don't blame them. I think that it's going to be probably a bigger revolution than the insurance companies might like, as I already know dozens personally who are just getting ready to shed the yoke of insurance and become more along the lines of a fee-for-service practice to basically earn what they should. So that said, I appreciate you joining me in this video. Thank you so much for joining me, and I hope you're all staying well and healthy.